So everybody knows I'm a play specialist. So what is play? I'll just do a general what is play first. So it's a child's work, it's spontaneous, it's relaxing, it's familiar, and play is a child's natural way of learning and developing, and play is fun. So we all probably have some kids that we know are grandkids, and they play. They just play everything. We learn everything from when we're little through play. So it's really important to introduce play at a very early start. And that's what we do by cluing, by talking to little babies. It's all education and learning them for the future. So I suppose play in hospital is so important. So play is especially important for children in hospital. Toys and familiar activities make hospital more welcoming and homely. Play helps children to relax and cope with being in hospital, as hospital is extremely stressful for both child and parent. So when you're coming to our urgent care, the patient's parents are usually really upset. The kids know that something has happened to them. They're hurt. So I suppose they're so fearful of the big thing that's going to happen, because they know they have to come and get that injury fixed. So when they come in, they can be really upset. But by offering some toys to them, it's amazing the way that they settle down straight away. And when they're more calmer in our department, it's easier for the doctors to make an assessment and know exactly what their pain is. Because if they're screaming through pure anxiety and fear, we can think their pain is much more than what it actually is. But when you give them some toys or some colouring, some paints, it settles them down, it gives them a bit of that normal they're used to at home, and we're able to assess them a little bit easier. And it makes everybody, I suppose, for the parents too, it relaxes them to show that they're not as hurt as what they are. And as I said, ED is so stressful on parents and kids. So anything to give them, it can be the littlest things for them. So any little thing at all, just to help them calm them down and relax, it really makes a difference. So when children in hospital, they're faced with unfamiliar surroundings, different sounds, smells, foods, routines, strange beds and equipment, and in some cases, limited family contact. That's a huge one now with COVID. There's such limited family contact. Generally, it's only one parent with them for their whole visit. They would be used to another guardian coming in, their aunties, uncles, cousins, friends. So for anybody with a long-term condition, it is extremely hard for them when they're long-term in hospital that they can't have that contact. We have made some help. We have iPads, so we're able to FaceTime, and it's what we're doing here through Zoom. For the ED department, it can be stressful on parents, but I suppose limited family contact doesn't really affect the patients coming into urgent care. As we still only allow one parent, but the parents can do a swap if they're here for a certain amount of hours. So for the ED wise, I suppose limited family contact is a little bit less. But like that, there's a lot of strange smells when you come in. Food is different. We're different routines and just unfamiliar surroundings. In the ED, everything is so medicalized. So it's as soon as they go into the room, there's equipment everywhere, and straight away they're fearful that all this equipment is going to hurt them. And now that we're wearing PPE equipment as well, all they can see is our eyes. And if we're in full PPE equipment, really, a lot of the kids are very frightful. They're like, please don't put that stick up my nose, because a lot of them have been swabbed. So you're facing that straight away from the minute they come into the waiting room. So there's lots of extra stuff now with COVID we have to consider. So as I said, it's estimated that a child will face 52 new faces within the first day of admission. And on top of that, they have to cope with their illness, condition, or having surgery. 52 new faces to a 4 or 5-year-old or a 6-year-old, regardless of what age you are, is huge. In ED alone, you can see up to 20 people, and in urgent care, you can see up to 15 new faces, depending. That's including cleaners, HCAs, radiology staff. So it's a lot of faces to cope with when you're little. So, and on top of that, you may be going for emergency surgery, or you may need bloods and stuff. So it's a lot of new faces for the little people that we see here. So research has shown that hospital, whether short or long-term stay, can result in emotional distress, behavioural problems and regression. So anybody that has a long-term illness, regression is huge. They can, for a little one who may have given up their dodie or their bottle, it's back having their dodie and wanting their bottle. Behavioural issues can become a massive thing, but this is just all of the patient's way of coping what's happening with them. They've been taken out of their home very suddenly, and now they're in hospital for a few days. So you can totally understand, we'd all be distressed too if we didn't know what was going on. So they're massive ones that we always have to keep and I suppose be mindful of as well for them and try and help where we can. But I don't think it's a bad thing to give the Dodie or the bottle if that's the regression they're going through right at that moment in time, because once they hopefully get home and get settled, that will eventually, I suppose, go away a little bit. So I suppose with those three things in mind, that's, I suppose, a lot of where the role of the play specialist comes in. So a play specialist uses play as a therapeutic tool for children and young people who are inpatients or outpatients in hospital. The title hospital play specialist was coined in the 1970s to define the role of a group of staff who support children through the use of play in hospital. A hospital play specialist is trained to identify the needs and fears of children in hospital and to provide specialised play to help them cope. And play specialists work with children and young people of all ages and conditions in their work. So our work involves, this is only a small list, there is so much more to it, but the majority of it is to provide play to maintain developmental goals and avoid regression. Again, go back to long-term. If you have a long-term patient who may be in from the day they were born, they're going to be behind in their development from the very beginning. So our job is to introduce stuff that we try, along with the other parts of the MDTs, to bring on the development goal. And if they are in hospital and have been meeting all their developmental goals, to avoid regression. So that would be introducing specific ties to make sure that they don't regress back to where maybe they were before. Helping children deal with fear and anxiety by making sense of frightening and unfamiliar experiences. Using play to prepare children for invasive or painful procedures. I have a little bit more about that, so I'll talk about that after. And helping children cope with pain, using play as an alternative focused activity to help distract and calm children during procedures. And helping children regain skills lost through the effects of illness and hospitalisation. So our role is to work as part of the MDT, supporting families, including siblings, through a family-centred approach to care. Working with the siblings of a child who is long-term is absolutely vital to try and keep them involved and make them feel as part of the care that's going through. Siblings can really suffer at home because they're being left with aunties and uncles and I suppose grannies and granddads and neighbours, and their family mightn't be there for a amount of time and they're hearing that, oh, Mary got presents all day, but yet they're like, God, she's getting presents and I'm stuck here eating porridge in Auntie Mary's house. So it's really important to make sure that we actually involve them. So I suppose pre-COVID times, we would always try and get them in, and if they have any questions about what's happening to their sibling, we would answer them. Sometimes we might do some sibling play where they get to express their feelings about their sibling. And you know, sometimes it can just be the little things of, oh God, they always get a present when they leave hospital and I never get a present. So it's for them to work out their frustrations as well and to understand that actually their siblings go through quite a lot, but that we understand that they're going through a lot as well. Contribute to clinical judgments through documentation and through their observation, and advising parents, carers and staff on appropriate play for sick children and adolescents. So I suppose our bread and butter, the types of play in hospital is preparation play, medical play, distraction play, post-procedural play and normalising play. So I'll just touch on a few of these because being in urgent care, we do very little medical play and we'll do a small bit of post-procedural play, but because urgent care is such a busy spot and you have a quick turnaround, the idea is to get them in, get them out with as little stress and distress as possible. So the aims of preparation for us is to help a child understand their illness and treatment. So when a child understands what's actually happening to them, they're far more likely to be cooperative. And they'll understand it. So we do it in a way that they understand, and that's through play. So for myself and a lot of the other play specialists around CHI, we all have medical dolls. I'm sure you've seen a lot of the prep equipment. So we all have prep equipment here and we prep the kids using the real medical equipment on our dolls and on themselves. So for some of our kids here who might be coming in and for a really bad dysformity, sometimes we need to give them a small bit of sedation to maybe straighten that bone before they are moved on to another hospital. So with that, we have like the mask that they use for taking the gas and air in. And the simple thing is that it actually smells terrible. The smell of plastic is rotten. So the simple little thing was that I went and bought some lip balms, and you give them the choice of what kind of flavored lip balm they want. So it could be Coke or strawberry or mango or melon. So when they pick that flavor, it's given them a little bit of an opportunity to go, okay, well, I've control of this. So by doing that, it gives them a little bit of a nicer smell, and the mask is not as scary to them because they're kind of eager to get on and lick the mask with their face, with their tongue when they taste the stuff. It also to correct any misconceptions or fantasies that children may have. I think when patients come to hospital, they have this fear that the needle is 6 inches long, and that when you come to hospital, that's all you're going to get is loads of needles and it's going to be very sore. And I see that all the time in urgent care. You'll hear the kids with COVID now, it's like, please don't stick up my nose, or am I going to get loads of needles? And a lot of the time it's not. So you have to kind of give them an idea, or if the doctor's told them they're going to straighten their leg or fix their leg, for some kids that might be like, oh my God, my leg's going to be taken away, or is it going to be very sore? So my job is to go in and, as I said, explain exactly what's happened to the best of my knowledge. Not always going to work out exactly like as we planned. So by explaining exactly what's going to happen, you're giving them control, and you're also getting them involved as well, and they know exactly, and we come up with a plan of what exactly they would like. The opportunity to express their feelings, fears and anxiety, increase the ability to cope with the treatment, and to reduce long-term and short-term psychological effects of hospitalisation, and that's very much focused on your inpatients. So I suppose by preparing them, letting them talk about their fears, you can answer their questions to the best as you can. I never promise anything. I only promise something that I know I can actually keep. And if they ask, I always ask them to ask questions, that no question is ever silly, because some kids, and especially young teenagers, are afraid to ask. So by even giving them a little piece of paper and a pen, I get them sometimes to write down their fear. Yes, it's an urgent care and the doctors are waiting, but they can wait 5 more minutes for that child and teenager to write their name down, or to write their question down, sorry. So that then they can give you the question, you can go away and you can answer it for them, and that can sometimes make it easier for them. As I said, the more prepared they are, the more likely they are to cooperate with you as well. So preparation means, I suppose, I link in with the nursing staff and the medical staff to what the procedure the child is having. So urgent care is you kind of generally know what's going to happen, but it's always important to link in, because there may be a different procedure they're going to do. So it's always important to link in with the doctors and nurses, get a fair idea of what's happening, and then you're able to go in and work with the child. Build up a relationship with a child. Again, in ED, that can be so hard, because when you're an inpatient, you may have a couple of days if you know the procedure is going to happen in a couple of days, you have a couple of days to build up that trust. It's really important to build up trust, and in ED you have to build up that trust really quickly. And again, that's where normalized play comes back to. By bringing in some toys, bringing in some colouring and introducing yourself. I always tell them, I'm not medical, I can't do anything to fix their injuries, but I'm going to be here to make sure that anything they're not sure about, I can help them, but I just can't help them with their pain or their medicine. And I wear a different uniform to everybody else, so I think that also helps as well. So sometimes I would just have a little play with them, get to know them, chat to the parents, and sometimes that can slow up things, but that's okay, because as long as the child is happy and less stressed and leaves with a smile, that's all that matters to me. The doctors don't always agree with me, but they just work with it anyway. Access to the child's age, cognitive development, emotional maturity, previous hospital experience, and that all comes from the parents. And the parents are, I suppose, they know their child better than we do. I've only met that patient for about 5 minutes. So I always talk to the parents after I've spoken to the child and ask them what did they feel is best. Is it best to prep them? I should have said, sorry, preparation doesn't always work for everybody, and not every parent wants their child to be prepared. Some parents are like, no, just go in and they'll handle it better if they don't know. We do try and prepare where we can, but I suppose we have to go with what the parents, we explain the benefits of preparation, and then it's up to them. So you just have to work with what they feel is best for their child. As I said, I only know that child for a few minutes. They've known them for a long time. As I said, discuss preparation with parents and child, explain using language that children understand. So it's very much breaking it down in, like, I'm obviously not going to use Peppa Pig on the 16-year-old compared to what I use in the 4-year-old. So you just have to work a little bit differently as well, and answer all questions truthfully. There is no point lying, because the kids will ask you if it's going to hurt. And I suppose my simple answer always that is, we will try and not make it hurt. We've given you all the medicine, so if it doesn't hurt, so it shouldn't hurt. But if it's hurt, ask them to stop and we can take a 10-second break. So it's always important to be truthful, because if you tell them it's not going to hurt and it does hurt, straight away you're breaking that trust, and the trust is everything with a child, and it can take so much longer to get it back. So once you've been prepped for a procedure that's going to happen, we would then be in the procedure doing distraction. So the distraction doesn't alleviate the pain, but diverts the child's attention away from the procedure. However, some children respond better to watching to the procedure. Again, during preparation, we'll always speak with the child and the parent, or the teenager, should I say, and we'll ask them, like, do they want to watch? And a lot of the time the parent will be like, oh God, absolutely not. But that's the parent that doesn't want to watch. And the child will be like, no, I want to watch. And I suppose I've been in this game long enough that I kind of know by the kids and the teenagers' body language that they'll actually be fit to watch it or they won't. And you can sometimes still say, yeah, and you can be like, right, you can watch it. And then next thing, it just goes belly up and they're not able to watch it, especially if they're having bloods or something like that done. So we use lots of just different distraction methods. So we're able to distract them during the procedure. And as I said, it doesn't alleviate the pain, but it kind of distracts them from what's going on. And when they're distracted, sometimes they don't feel the pain as much. So for babies, we would always say a bottle or a soother, like lots of cuddles from mommy or daddy or whoever's with them, music CDs, bubbles. Oh my God, I miss bubbles so much, but unfortunately we can't use bubbles now due to COVID and we're all wearing masks. Bubbles were, I think, a play specialist thing that was always in our pockets. Bubbles was the answer to everything, but we've bubble guns now, but it's not the same thing. Noisy toys, pop-up toys, etc. For older kids, whereas Wally book is invaluable, whereas the dinosaur and whereas the unicorn books are all brilliant now. Sometimes some of the teenagers will just want to listen to music and they just put on their AirPods and listen to it that way, and that's totally fine too. What else do we use? Electronic devices like iPads, Peppa Pig, CoComelon, Baby Bum, all them are excellent. So we're very lucky here in Connolly that we have several iPads and electric devices, so we're able to use those for distraction as well. And then for some of the older kids, and if I have a little bit more time, I would do some guided imagery if it's going to be a long procedure. And some teenagers will refuse sedation, which is totally their choice because they may have had it before and had bad times with it. So I suppose sedation makes the child unaware of what's happening, but it can give them terrible, weird dreams, and it can give them hallucinations. So for some teenagers, they may just not want it. I would only try this on a child, I suppose, maybe above 8, just depending on how I felt. So guided imagery is simply where you talk to the child throughout the procedure and you talk to them about their favorite place. So it might be at the beach and you're asking open-ended questions. Well, what's on the beach? And they'll say the sand. And can you feel the sand through your toes? And they're like, yeah, I can feel the sand through the toes. So you keep asking them a lot of open questions and they get so involved that they nearly feel they're at the beach while the procedure is happening. So guided imagery, it can work and it can't work sometimes. It just totally depends on the given situation, but you need to have a very calm teenager, a very calm environment and quite a quiet one. So it just depends on the procedure that's going to happen at the time. So after distraction, hopefully everything has gone well and you've got the patient through without as little stress as possible. And we would sometimes do post-procedure play. So this allows the child to talk about what happened during the procedure and feelings they had during the procedure. So I will always ask them, did you feel anything? And sometimes they will say yes, and we'll talk about like, what did they feel? And a lot of the time they'll talk about tightness or pressure. It's never pain. They might talk about the dreams they had, how they were, I don't know, seeing dinosaurs or they were unicorns or they were flying. So it's really important just to ask them some questions so that if they ever appear again, you know exactly whether it worked for them or it didn't work. I suppose by having a play specialist with them, we've seen in urgent care here, with me being here, that we've had to use less sedation on patients, which is amazing. So I'm able to get them through different procedures without giving them any sedation, which means they get to go home a little bit quicker. And it's less, I suppose, medication go through their system as well. Because sedation comes with its own risks and you don't want to have to sedate every child to get a procedure done. So I suppose that's where my role comes in a little bit more. So I suppose we're very lucky here in Connolly. We have an actual multisensory room in our urgent care. And to say this is the most valuable room in the whole building is an understatement. We get a lot of patients through our doors with autism, like the other EDs. And I suppose the way we're different is that our multisensory room can be their waiting room. They can have all their, I suppose they can wait there for as long as they need while the doctors are waiting to see them. Sometimes we can do certain procedures out there, like just your basic looking in their eyes. We'll never do bloods or anything traumatic in our multisensory room, because that's not what it's for. We'll always bring them to a room to do that and then bring them back to the multisensory room to settle them. The multisensory room is not used as a room for procedure. It's used to keep them relaxed and keep them happy while they're waiting. And like all EDs, there is a waiting time here. So the environment is much quieter. They don't have to be in a big, noisy department where there's bright lights. It's all just really nice and low lighting. And as I said, the doctors can come out to them, the nurses can come out to them and check. And if we need anything done, then we can bring them into a room. So our multisensory room, as I said, is based beside the waiting area in urgent care. This room is for all patients who are attending both urgent care and OPD. There's a booking system in place, and the room will be prioritised, depending on the patient's needs and abilities if there's more than one patient needing the room. So far we've only had a couple of times where we've had a few patients, so we just put a little limit on it of 45 minutes. But like that will depend on what patient comes in. If there's a patient who has severe autism and really struggling to wait, we'll just get the room ready for them, because at the end of the day, they're a little bit more prioritized than the other, maybe someone else that's using it. But we haven't really had that situation so far. So hopefully that will continue. We are looking about getting a multi-sensory room in our outpatients department as well. But like that, funding is a big thing. So we'll hopefully get that in the next year or two. So our multi-sensory room has been specifically designed to give patients an opportunity to completely relax or access a wide range of sensory experiences for therapy, learning, or fun. The multi-sensory room can be used by patients of all ages and abilities for relaxation, focus work, stimulation, communication, and stress relief. This controlled environment offers many benefits to the well-being of the children while in urgent care. This room has proven very beneficial to children with intellectual or learning disabilities, physical restrictions like hearing impairment and visual impairment or behavioural disorders. We don't just use the multisensory room for children with autism. It can be used, as I said, for children with special needs, but also we're seeing a lot of teenagers coming in with mental health, and sometimes it can be very hard for them to sit in the waiting room. So we always, where it's free, we offer them the sensory room just as a little bit of a chill out time, and it's more relaxed and it's less medical looking for them as well. And sometimes kids who are extremely anxious about being in urgent care, again, we will put them in there, and I would go out and see them out there and explain exactly what's going to happen. We have photo books out here. So for children with autism, we're able to give the book to the parents. So while they're in the sensory room, the autistic child or teenager can flick through the book and see what the department looks like. So it shows the room, it shows the nurse taking a blood pressure monitor, it shows taking their temperature, and if they have to go to radiology, x-ray, it shows what it looks like there. So they're just little flip cards with very little writing on them, just to explain their journey. So while they're in there waiting for everything to happen, they can be looking at that while that's going on, and hopefully they're able to then process the step by step. And in fairness, I think we're pretty good here at like taking our time with them. We can lower the lighting when they come into the department as much as we can. Suppose pre-winter, we probably would have been able to do a little bit more, but because the winter surge is on now and kids are quite sick, it's just a little bit harder, and the department is much noisier. But we have ear defenders at our reception, at both reception areas. We have ear defenders, so we can offer the parents ear defenders if they feel that that's what their child needs. So this is a picture of a multi-sensory room. Apologies, my photography skills are not very good, but it's just all nicely padded. It has, as you can see, fibre optic lights. It has a bubble tube there as well, a projector, it plays some music, and then we have a little sensory box with some sensory toys in it, like squishy balls, kaleidoscopes, and some scented stuff as well. And we have a massive big beanbag that all the parents love to seem to stay on. They're always chilling out there while they're waiting too. And that's just another picture of the multisensory room. So we're really lucky. So hopefully going forward in the new children's hospital, there'll be several multisensory rooms, but there'll definitely be one in the emergency department. And then they're hoping to have one on each floor as well, but we'll wait and see. But that's the gist of it. So hopefully that'll be, because I suppose you couldn't value this room. It's unvaluable, if that's a word. So I suppose play in urgent care, I suppose we view it. Me coming to urgent care, most of the girls came from emergency departments, so they had no idea about the importance of play. They had no idea what a play specialist did. So when I came out to a very new gang of new doctors who had no idea. All the emergency departments across CHI are looking for play specialists, but they haven't been able to get funding to get it secured. So a lot of them didn't know, and they're very much like, just go in and get the procedure done and get the child home. So it took a little bit of time and me on their hips and asking loads of questions about I suppose, to get them used to asking for me. Now, there is the odd time where they'll go off and do something, I'll be like, come on now, I should have been there, but they are getting better. So after a lot of education and stuff, I'm hoping they view play the way I do, but play is a fun, enjoyable activity that evaluates our spirits and brightens our outlook on life. Play reveals feelings of stress and boredom, connects us to people in a positive way, stimulates creative thinking and exploration, regulates our emotion and boosts our ego. In addition, play allows us to practice skills and roles needed for survival, and learning and development are best fostered through play. Play is at the very centre of a healthy child's life. From the earliest age, playing helps children to learn to relate to other people and to have fun. And when children or teenagers are admitted to hospital, they are at their most vulnerable, which is so true. They are not only ill or suffering from an injury, but also separated from their friends and familiar surroundings. And play can really make a difference. So when you're admitted to hospital or come to urgent care, it's a scary place. The environment is so big, it's noisy. There's medical people walking around, there's medical equipment everywhere. It doesn't matter what corner you turn, especially in urgent care, there is a piece of equipment somewhere. It is a little bit child friendly, but urgent, it's still very medicalized. And now with COVID, as I said, we're all wearing masks or in full PPE. So to a little person looking up at you, it is very scary. So play can make a difference. There was a time where we could have a few ties in each of the room, but unfortunately now with COVID, we can't do that. So we're limited in what we can give into them, but we can still make a difference. Piece of paper and crayons can still make a difference. It doesn't have to be loads of toys. And sometimes blowing up a glove and making it into a funny face, that is all they need as well. Perfect. So passionate about play and why. I hope I come across passionate about play. So it creates an environment where stress and anxiety are reduced. As I said, you have that screaming child who's in triage and is so scared of everything because they're so afraid. By getting them into a room, me going in to say hello, and I suppose giving them some toys, straight away within 2 minutes, they stop crying. You ask them what they like to play, and they might say dinosaurs or Barbies or unicorns or diggers. And the majority of the time we have that stuff, and straight away they're playing on the bed and they're much happier, and the parents much happier. And I suppose when the patients are a little bit happier, the parents are happier. So the wait time, I suppose the waiting to see somebody is not as bad. And as I said, the doctors were able to go assess them, and straight away you'll know what their pain score is because they're more settled than when they first came in. It helps children regain confidence and self-esteem, provides an outlet for fear or anger and frustration. I suppose that's really focusing on your medical play, where you would do some role play with the children first, or the patients or teenagers. And that's where you can figure out what they're fearful about. And it might be the needle. I heard the needle is really big, or I heard I have to take all this medicine. So by, I suppose, prepping them and preparing them for what they're going to do, it's much easier for them then to feel, I suppose, more in control. And I suppose it gives them a little bit of independence, because when they come first into hospital, all their independence go out the door. They're told what to do, they're told what time to go to bed at, they're told to take this. So you have to give them a little bit of independence back as well. It also helps the child understand treatment and illness. As I said, through play, children are able to effectively learn the sensory and concrete information they need to prepare for hospital procedures and treatment. I think we can do all the distraction in the world, but I think if you can't prepare a child for a procedure, it leaves things much harder on people. And look, that's not always going. Play specialists are not in the hospital 24 hours, 7 days a week. So kids are unfortunately going to have to go through some form where they mightn't get a lot of prep. But I'm hoping here, I know anyway, well, most of them do, the nurses will take a little bit of time out and prep them as best they can to explain what's happening. But that's only through education with myself, and I suppose explaining the reason why. So hopefully as time goes on and more play specialists are in our EDs, that we will have even 5 minutes of explaining or answering their questions is really important. It aids in assessment and diagnosis. As I said, if a child is screaming and then you think they're in severe pain, and you might want to give them stronger medication, but if they're playing and happy enough, then you know that their pain is under control. And it speeds recovery and rehabilitation. And again, if that's really focusing on your inpatient, or sometimes it can be in urgent care here as well, they may not be able to get out of bed. Oh, I can't put my foot on the ground, and you introduce some toys on the ground, or you might introduce a football like we do here. And I have a softball here in urgent care. It's miracle ball, as some of the girls call it. And we will have kids coming in who are not able to put their foot to the ground, and they just can't do it. But it's amazing the way, with a bit of time and maybe getting the football in, and next thing they're kicking and running up the corridor. or some kids who might have like pulled elbows, just where their elbow locks, and they've been holding it for days, and then we unlock it for them very simply and they still can't use it. But by introducing toys, straight away they get to use the hand and they realise it's not sore. While if we didn't have that kind of stuff, I suppose they could be sitting there all day. The doctors might feel it's worse than what they thought, and it may result in like having extra testing done, which we don't want. So I suppose it's really important to have toys. As I keep telling my infection control team, we still need some toys, even though COVID is still out there, we still need some bits to kind of get us through as well. And I think that's it.